Hi, my name is Jayla, and today I will be educating you on HIV, or human immunodeficiency virus. The human immunodeficiency virus is caused by a retrovirus. A retrovirus is a virus surrounded by many viruses that encrypt or obtain ribonucleic acid genomes. How does HIV come about? What is the cause? So, the cause of HIV, or human immunodeficiency virus, is engaging in sexual activity which shares vaginal fluid as well as semen, or even anal intercourse as well. Also, engaging or coming in contact with blood is also a way that this virus is transmitted from one individual to the next. If left untreated, human immunodeficiency virus does turn into autoimmunodeficiency syndrome, which is AIDS. AIDS is what occurs when HIV is not taken care of or is not known by the individual. When we look at HIV, what are some risk factors, or what are some things that put others more at risk? Remember, anyone can acquire or obtain human immunodeficiency virus. It does not discriminate. No matter your demographic background, where you're from, your sex, your age, or nationality, does not make you less likely to obtain the human immunodeficiency virus. But there are risk factors that can cause one individual or many individuals to be more likely to obtain the human immunodeficiency virus, such as engaging in unprotected sexual activities, which shares those vaginal fluids or semen from another individual. Using or participating in drug use, such as sharing contaminated needles from individuals who you are unaware of their HIV status if they are either positive or negative. Alcohol. You may wonder, how does alcohol contribute to someone obtaining HIV? This is through the alterment of their decision-making process. When someone is under the influence from alcohol, their decision-making process is not as keen as before, which can present more risk factors for them obtaining HIV, such as engaging in unprotected sexual activity while under the influence, or drug use, such as using contaminated needles. When we look at HIV, there are symptoms and signs. Some symptoms include fever, fatigue, body aches, chills, swollen lymph nodes, and scratchy throat or sore throat. And then some individuals may not present with symptoms. Dependent upon the person, after infection, it may be a while before individuals start presenting with symptoms, or it may be abruptly from 2 to 6 weeks from being infected. Can HIV be prevented? Yes, it absolutely can. And the ways that we can do that and ensure that is through testing. If you engage in sexual activities with individuals and you're unaware of their status and you do not use protection, you can get tested just to be safe and just to be sure, to make sure you are not carrying the HIV, or human immunodeficiency virus. Using protection such as condoms while engaging in sexual activity can also prevent the spread of HIV. Other ways to prevent this virus is practicing abstinence, which is not engaging in sexual activity at all, or lessening your number of sexual partners. While lessening your number of sexual partners, you also lessen your risk of obtaining or acquiring human immunodeficiency virus. Is there treatment, or is there ways to help this virus? Yes, there is. ART, antiretroviral therapy, is a form of many medications used to slow the progression of HIV in individuals. Through the visual representation presented in my presentation, you will see that it shows the prevalence, death, and life of individuals living with HIV throughout the years, from a decrease to an increase. I hope that my presentation was informative and educational, and that it can help you or someone else. Thank you.